Hey everybody, I wanted to give you the latest and greatest hip update and how the word of the year has played out for me this year. And if you're not sure what the word of the year is, for the last 20 to 23 years, I've chosen a single word that sort of acts as a thread that gets woven into my entire year. I think of this in terms of the decisions that I make, the actions that I take, even my thought process. I link it back to the word of the year. And it's been interesting over the 22 years just to see how that intention gets built into my life. And sometimes it's been absolutely incredible, and other years it's like, why in the world did I choose that word? And this is a year that I chose the word equanimity as my word. And equanimity, as I like to define it, is to be steady and unwavering no matter what shows up. So can I be steady when life is amazing and successful and abundant and full of love? Can I just remain steady and unwavering? And when life is really hard and challenging, can I remain steady and unwavering? So I set that ball into motion in January 1st. And how I typically do it is I define the word, and then I create an action plan. I'm all about an action type way of being. And I jotted down some ideas of how equanimity would look in my life. Knowing I was going to have hip replacement way back in February, I set out to go through that journey and the healing process with equanimity at the forefront. And if you've been following all my videos, you know that it wasn't a simple hip replacement. It turned into an absolute nightmare. And I ended up having another surgery in April to open the incision back up, clean it out. There was a suspicion of a hematoma infection. And so I was treated with antibiotics that I had horrific complications from blood clots in my arms to significant and severe skin reactions, lots of trips to the ER. It has just been really, really hard. And then back in July, things were going pretty well. I felt like I was healing and I was on track, wasn't in a lot of pain. And then the game changed again, and my hip swelled up to what I refer to now as the great white pumpkin on the side of my hip. My incision is so deep because the swelling is so big, and that led me to a specialist who deals with complex revisions, infections of this caliber, and finally got a plan yesterday afternoon. And so throughout this time from February 5th, when I had my total hip replacement, to today, it has been a true test of equanimity. And I feel like I've done really well. I thankfully have a lot of tools in my toolbox to remain steady and unwavering, and I don't have a lot of fear operating in my life. I'm very trusting and very hopeful, even given the amount of complications and detours that this year has taken me. So my plan now going forward, I've had 2 aspirations to pull fluid out of my hip and test it for the same tricky bacteria. So far, the preliminary results are that it has not grown anything, which is great news. We have 1 more week for it to grow something in the little petri dish. But my labs look pretty good. So they're thinking that the bacteria is not present, which is amazing news, because had it been present, they would have had to remove my entire implant, and that would have been catastrophic. So the plan for this, the MRI shown that my joint capsule is that connective tissue kind of sheath that surrounds the hip joint or any joint has ruptured. It's torn, which is why I have all the fluid that's just being dumped into my leg. So my great white pumpkin is coming from synovial fluid that is leaking out of my joint. It should be encapsulated by that joint capsule, but the joint capsule is ripped, significantly ripped in 2 places. So the plan is to culture another week, let the growth grow if it's going to grow, and then set a surgery date to open up the incision once again. This will be the third time this year I'm having hip surgery, which is a lot. It'll be my 6th hip surgery on this hip. And so she's tired. She's tired of being poked around. And so hopefully the surgery will be scheduled in a few weeks. I'd like to finish up November and just kind of keep going as best I can. Let the pumpkin continue to be a pumpkin. And then I'm hoping the first week of December, I can go in for surgery. He'll open up my incision, drain all of the fluid, get the fluid out, wash everything out with heavy duty antibiotics, put some antibiotic beads inside my hip, and test the tissue, because the tissue is where we really learn what's going on. Fluid is a great indicator, and blood labs are a great indicator of bacteria or infection, but it's really the tissue. And so at this point, we're very hopeful that the bacteria is not present on or in the implant, but that lingering kind of, there's still a chance because they'll test the tissue. So going in, hopefully the first week of December, he will repair the joint capsule with heavy duty sutures, as he called it yesterday afternoon, that are permanent sutures. They won't dissolve, they won't go away, they will just keep that joint capsule intact. Now, the caveat to all of this, and the tricky part that nobody really knows, and so maybe if you're going through this, you know, and you could help me out, is I have a connective tissue disease, autoimmune disease that attacks my connective tissue. And so there's no reason for my joint capsule to have erupted other than had I dislocated or fallen down the stairs, which I have not done. And so the theory is my body attacking the connective tissue has caused its integrity to weaken and for it to simply rip. Now, that's a huge worry for me, because there's nothing to say that this isn't going to happen again because of my autoimmune disease. So it's scary, but it has to be done. Like, my leg is ginormous and it has to be done. So I tear so easily. It's kind of a funny story. Last November, I was scooping out baking soda out of one of those big Costco size baking soda bags for bath bombs. I make bath bombs this time of year and sell them. And so I was scooping out some baking soda, and I pushed really hard on the measuring cup, really hard, against very hard and cold baking soda. And my middle finger actually tore off, like middle finger went flying off, and it was just sort of hanging by skin. And so I had to have surgery to reattach my ligament from baking soda. So my connective tissue has zip integrity. So there is that worry, and I'm not sure what to do about that, but nobody does. So we're just gonna trust that my body will not do this again, and I won't rupture my joint capsule. So that's the update. I will pop on again when I have a surgery date or get a little closer, kind of get a timeline of what's going on. And I'm gonna remain steady and unwavering because I'm so close to the finish. What do you think my word of the year will be next year for 2025? The 2 years that were the hardest years of my life since doing this were the year I chose peace and the year I chose equanimity. So we have to be careful with what we set into motion. The year I chose peace, I thought it was going to be a peaceful year. It was the hardest, one of the hardest. This is the hardest, but one of the hardest years of my life. So I love to teach the concept of word of a year. So as we get closer to that, be sure to subscribe to this channel so that you get that information, because I will be doing a series on choosing a word and having an intention and what that looks like in action, because it's very easy just to say, oh, I'm going to be patient this year and then forget about it by middle of January. Doesn't work that way. All right, so that's what I got for you. I'm going to remain steady and unwavering. I'm going to face this with courage and bravery and trust and hope, and I'll get through it. And when December 31st comes, there will be a big exhale of equanimity, and we're going to be done with it. Doesn't mean I'm going to go haywire in January and not be steady and unwavering, but I just hope I stop being tested. All right, I'll see you soon, and thanks for being part of my healing tribe, and everyone who watches this that's going through it. I absolutely wish you the best in healing and mindfulness as you do it. Take care. I'll see you soon. Bye.